they have the trouble with reality. They have the trouble with reality, the real situation. So the existing situation. So they cannot understand what is going on, real situation or the truth. They have trouble with the reality. So we cannot emphasize the things for them. So that is why we call that they have trouble with the reality. And another characteristic, hard for someone to think clearly. So they if you search search an image for the psychotic disorders, you will receive a picture, an image with a brain with wired brain. So most of the nerves or the connections are not clear. So because due to this reason, I think it's very difficult to think properly, think clearly. So several ideas, the number of ideas come to their brain, come to the mind, which they cannot categorize. So they cannot express or they cannot make judgments. There are several symptoms. So hard for someone to think clearly. They cannot think clearly properly. If their mind is not work properly, they cannot think properly. And because of this reason, they cannot work properly. And they can't make judgments. So I discuss the cognitive functions of our mind. So making judgment is a higher order ability of a human. So they can't, if they are suffered with this psychotic disorders, so they cannot make clear judgment. They can't take a decision, judgments. They cannot decide what is wrong or what is right. Likewise, they cannot make judgments. Judging a person or a situation, they can't do it. And the next point is they cannot respond emotionally. So, what the emotional activities are. So, emotionally, they don't get anything emotionally. So, sometimes if the person is participating some mood events or some emotional situations, such as a funeral or a wedding, so they can't accept that emotional situation. Sometimes they may behave different, they may express different emotions which is not suitable for the situation. For example, if the situation is very a sad moment, then they express some different emotions. So they cannot respond emotionally. They can think whether this behavior is suitable for this occasion or not. So that is the problem with them, with this psychotic disorders. And due to these reasons, they cannot communicate effectively, they cannot express their views, express their thoughts. Most of the time, they will not talk with their others because they have several things in their mind that not clear, clarity is very less, so they cannot gather their thoughts in an effective way. So communication disorders also there, can't communicate effectively, and they cannot understand the reality, the coupled with reality. They cannot understand the real situation or the cause and effect. They cannot think beyond the situation. They cannot justify the other one. Others also cannot justify for them. So they don't understand the real environment, real situation, and don't understand the real reality. Other with the reality, and they cannot behave appropriately according to the situation, according to the environment, according to the current situation. They cannot behave. They cannot work on it. So this is a real pathetic situation, pathetic disorder, psychotic disorder, very dangerous. It means there are different reasons for it. So psychotic disorders are very dangerous situations. So they cannot behave appropriately according to the environment. So, and there are some other characteristics. Psychotic disorders or the diseases, we normally, if you take the stress or the stress or some other phobias, we don't consider them as a disease. You know what the disease is, so we do not consider them as diseases. Disorders, we call them disorders, but the psychotic diseases or the psychotic disorders, we can call them as a disease. Diseases are the things that we need to give them the medical treatment. We want to give them the medical treatment because it's a severe type of disorders. So we need to treat them appropriately. So these severe mental disorders called diseases. Psychotic disorders can be addressed as a disease. So these diseases in very first moment we cannot identify. Very difficult to diagnose because we want to if we want to give them the medical treatment, then we need to identify them. But by looking at the physical features in the very first instant, we cannot understand that they are suffering with the type of diseases. So hard to diagnose, and it affects the way a person thinks. It affects the way a person thinks. So their thinking pattern may change due to this disease. Thinking, they cannot think properly, as I mentioned in the previous slide. So affect the way a person thinks. So sometimes they will not engage their proper day-to-day activities, life activities. They may not. Only the thinking process may change. So we can understand only that way. And processes affect the way of their processes, emotions, and maintains relationships. These things can be changed due to this disease. Relationship changes occurred due to the psychotic disorders, schizophrenia, or the bipolar disorder. This affect to their relationships. So, and affect to decisions. They could not take correct decisions. This will affect to the decision-making ability of a person. So earlier then we had a good good ability to solve the problems, decision making, creative abilities. So all these functions may change after this affection. So when we come to the reasons for these diseases, we can understand what the reason for this. So this biological changes may affect severely for this decision, this disease. So that is why why they cannot consider the decision making things. So the biologically, or the nerve system or the brain may affect severe biological reasons. That is why they cannot take the decisions. So very low decision making abilities are there with them. So unable to handle daily life. This is also very pathetic situation. So you have been seeing some patients are there. They cannot think properly. They cannot take decisions, and they cannot engage in their daily activities, daily life, eating, or the engaging in their work, which they cannot handle any of these activities. So this is also a characteristic of this psychotic diseases or the psychotic diseases. So first or the most dangerous psychotic disease is schizophrenia. So I have discussed about this disease. So I will briefly go through the content. So schizophrenia is differences in brain structure. So basically, if you scan the patient's brain or the brain structure to observe the brain structure, there can be abnormalities in the frontal and prefrontal cortex. So these are highly technical word. Technical comes from the bioscience technical jargon. So frontal and prefrontal cortex. So you can see if you search the brain, this there are four lobes, so four parts. So and this forehead is the frontal area, frontal lobe, and the prefrontal lobe. The areas can be seen some different structure, not the normal structure. So this may be the reason for the schizophrenic patient. So enlarged ventricles. I have added one picture. I will show you next slide. So enlarged ventricles. So we call this nerves can be seen in some enlarged situations. So having some large. So this is abnormal nerves have been identified in people with the schizophrenia. So this is the basically I told you that if the person is suffering with some biological malfunctions, biological disorders, so this is the first example for the biological malfunction. That is why we call the diseases such as psychotic disorders or the psychotic diseases, we cannot treat. So brain structure can be enlarged, or the changes. We can understand the changes. We can identify the changes in the brain structure. So this is the first reason for the schizophrenia and first signs. So in the childhood, you cannot see these symptoms, but if you observe them, so then closely, then most of the schizophrenic people came with their the symptoms came with their younger age, called teenage, or when they come to the ordinary level classes, then they may perform very well. They will perform very well, but when it comes to the advanced level classes, then people can observe the changes of their behavior. Some critical changes. Sometimes they may not work properly in the classroom activities. So teachers are the person who can understand them very well, the behavioral changes. So some behaviors may be changed, some decision making, some cognitive skills may not perform very well with this pathetic situation. So teachers can understand these changes. Sometimes parents may not be able to understand. So, but the young people show their changes. Thinking ability, cognitive abilities, problem solving abilities may change slowly. So first symptom is bad grades. Bad grade means bad or the weak results for the subject events. So, earlier they have performed very good results, good behaviors, but timely the grades change. So bad grades is one major symptom with these young people. So from this we can identify. And sleeping too much. They tend to sleep too much. They may addict to the sleeping too much, and withdrawal from friends. Earlier they had some, if they had some lot of friends, now they do not work with them, don't behave with the friends. So withdrawal from friends. So most of the friendships were neglected. So they try to live alone. So with these symptoms, firstly you may identify the schizophrenic patients. So if you have the experience with these type of people, you may understand these symptoms very well. First, they get bad results for their education, for the subjects. School may contact their parents several times with related to these bad grades, but most of the time people do not understand because due to the age, most of the time teenagers may affect with these symptoms. Teenagers, so 13 to 19, so very young age. People may not believe this as a disease. They will give some other reasons because these results of this teenage, they may not behave with the parents. They may not work with the parents, deviate from the parents and the other family members, so they cannot understand the real symptoms, situations. So we need to uh, pay our attention for those who suffered with these diseases. And there are some more symptoms. Two of the following symptoms for a month. If you can understand, mental disturbance over 6 months. If the person is suffered with this mental disturbances, such as these are delusions and hallucinations, there are two types of mental disturbances. First one is delusions. Delusion means this stage is we can see the severity of the disease, severity, mental disturbance of 6 months. So then you will see the delusions. Delusions is a false belief. You may suffer with the false belief that the person won't give up. So false beliefs is you believe the unrealistic things. Then they get proof that they are not true. So very difficult to emphasize that those beliefs are not correct or the beliefs are wrong. Very difficult to emphasize. Someone is plotting you. These are the example. TV is sending you secret messages. Is anyone is having these type of symptoms, delusions in the classroom? It's very dangerous because this is a dangerous psychotic disorder. So if person is suffering from this with different type of delusions, so the false beliefs, Paradi Vishwasya, you may not accept the real thing, truth. They are so very difficult to emphasize the reality. They don't believe someone is plotting you. Same කියන කවුරුරි මාව මාව follow කරනවා, plot කරනවා. So they live in the situation like that. Unrealistic thoughts may comes into their mind, unrealistic, not the real thing, unrealistic thoughts. Someone is plotting you, TV or the computer or your phone can send the message, but secret people or some unknown environment හරි වෙනත් ලෝකෙකින් messages ඒකට අනුව තමයි වැඩ කරන්නේ. Such a severe false beliefs can come to your mind. If this is called delusions, false beliefs. Delusions or delusions. Then there's another symptoms, hallucinations, or they can hear, hallucinations, hear or see things that are not there. Some hallucinations, some sceneries, some visuals, some scenes. But the person suffered with this disease can be seeing some hallucinations, because some false scenes, hearings, which the normal person cannot hear, they cannot see, but the person suffered with this disease can be expressed that they can hear some unusual sounds, unusual sceneries, they can see some unusual sceneries. But if the normal person looking at that, they cannot see, they cannot hear. So this is called hallucinations. So hallucinations and delusions are the most dangerous or the most false things that they can observe. Delusions and the hallucinations. එක සද්ද හෙනවා කියන කවුරු හරි කතා කරනවා කියන මේ වගේ දේවල් වෙන්න පුළුවන් මේ schizophrenic people. And later stage, depression symptoms. I have talked about the depression, so depression symptoms also can be seen. Feeling empty, so you don't have a feeling, empty feeling, so like nothing is coming to your mind. Empty feeling, sad, worthless. You may feel that you are not worthy to others, worthless. So these are the depression symptoms. So these symptoms or this feeling also comes to your mind, which is schizophrenic person. Lack of personal care. Lack of personal care, as I mentioned earlier, not staying clean or keeping up appearance. So they don't bother about their cleanliness or the appearance. Don't cut the beard or the hair. Don't think about their cleanliness. Disorganized speech and behavior. So they cannot gather their thoughts properly. That is why the speech may not organize. That is why they cannot organize their speech. Sometimes the thoughts come continuously. So then their behavioral pattern also may change rapidly, very quickly. Disorganized speech and behavior. So they cannot think properly. Due to this reason, they cannot speak properly. Disorganized. They cannot organize their sentences, cannot organize their speech. Mania or sudden out of character jumps in energy levels of happiness. So racing thoughts or risky behavior. Mania. You know what the mania is? Sudden and very quick changes in the behavior, happiness to sadness. Yeah, thoughts are jumping or the thoughts are racing. Change quickly, rapidly, very momentary. The changes change their thoughts, and they tend to take the risky behavior. There's a tempt or some risk behaviors can be seen. Catatonic or coma. Sometimes situations can be seen such as catatonic and coma. Coma is some feelingless. Catatonic behavior also seen. Feelingless behaviors can be seen. Good හැසිරීම බලන්න බෑ කොමා තත්ත්වයකට ඇවිල්ලා. Desire or hyperactive behavior. Desire is very laziness or some hyperactive behaviors also can be seen sometimes. You may have some very what we call the very good strength. Very difficult to control these hyperactive behaviors. You need 5-10 people to control one person for hyperactive. So very desired behaviors. So very difficult to control their hyperactivities. Activities may hide. So and another characteristic, isolation from friends and family. Isolate. They like to be alone. If they have a separate room in the home, then they always try to close the door, and no need to work with the family members. So this is very You can understand these behaviors if the person is suffering with the schizophrenia, so they want to be isolated. And noticeable mood changes. If you look at the face very carefully, then you can understand these behaviors, mood changes. Suddenly their moods may change, happy to sad. Likewise, quick changes can be observed due to these biological reasons. Mood changes are occurred suddenly, and you can notice it. Noticeable mood changes. Hallucination, delusions, believe something is controlling his thoughts. Some delusions. Some example for the sometimes they may believe that someone is things that controlling his thoughts. So they don't want to emphasize it. Some, for the example for the workplace. So co-worker is trying to hurt you. These are the wrong beliefs. Co-worker is trying to hurt you, but the person suffered with this type of wrong beliefs. We cannot uh, we cannot emphasize that these are wrong behaviors. So co-worker is trying to hurt you, like poison your food, or your spouse or partner is cheating on you. This is also based on the false thinking pattern or reality. Spouse or the partner is cheating on you, and people in your neighborhood are plotting to harass you. These type of wrong beliefs can be observed. So understand these negative thoughts or the wrong beliefs, delusions. And here, if you can observe frontal and forefrontal cortex, this is the normal brain, some thickness of the brain nerves, so brain parts. So you can see the difference between the frontal. This is the frontal brain, frontal and forefrontal. These areas may change. So reasons for these behaviors. Basically, you will see some brain tumors. Due to the brain tumors, you will observe these type of diseases, brain tumors, some brain infections, some infections to the brain, and stroke, and due to some drugs and the alcohol may be the reason for these pathetic diseases or the psychotic diseases, severe mental illnesses. These are the reasons for this type of severe illnesses, and you can treat them using medications or the medical treatment. You can give these antipsychotic drugs, because yeah, you can treat with these antipsychotic drugs. There are some medications, but the meditation do not mix the two words, medications and the meditation. So you do not you cannot do anything with the meditation. You have to give them the medical treatment. This is called medical, not the meditation. Don't mix up the two words. Meditation means not giving the medical treatment. Meditation is you can use for the neurotic or the less severe mental disorders or the diseases. But here you definitely you need to give them the medical or the medicine treatments. Antipsychotic drugs, you need to give some antipsychotic drugs, psychotic change, and electroconvulsive therapy. I told you ECT. You need to, here we provide some electric shock as a therapy. So then the ECT therapy will support to normalize their nerve impulses, nerve or the neural impulses. So ECT also one treatment for these psychotic disorders. Antipsychotic drugs, electroconvulsive therapy, and psychosocial therapy also can be provided. In the first instance, we provide this antipsychotic and electric ECT therapies, and when they come to some normal situation, then we can train them with the social skills and the other day-to-day life event practices. And after that, we can use psychotherapy with, such as psychotherapy, such as counseling, psychological counseling. Family members, friends also should be treated because they have to work with them. So family members and friends learn how to deal with their thoughts and the behaviors. And with the psychotherapy, we need to do that. And the patient learn more about his illness and its effect. Then we teach them to understand their thoughts. If they cannot cope up with the situation, then they know that they are facing a severe stage of their illness. So we can teach this, we can give the correct information to the patient and difference between what's real and what's not. We can explain these things and manage everyday life. We can train them to manage everyday life. Give me 1 second. There's a emergency call. I will give me 1 minute. Okay. Sorry. So these are the therapies or the treatment for them. So we need to give some drugs to change their dopamine level. If you come to the biological side of the disease, you may observe some the biologists or the scientists have observed that there may be less level of dopamine. The dopamine level is decreasing. So this will be the reason for the illusions and hallucinations, the delusions. So they give some medicines, the treatments to increase the dopamine level. So these are the medical treatments. Basically, we need to use them the medicines, and later stage we can go to the therapeutic things, psychotherapy and the other counseling therapies. That is how we treat the psychotic disorders. And here we have another severe mental disorder, the disease called bipolar disease. bipolar. So there are two polars in our brain. This is why we call this bipolar disorder, and we experience the person experience with the unusual mood disorders. Unusual, not very rare mood disorders. Now when it comes to the face-to-face classroom, if I explain this bipolar disorder, then the students normally know what happened to their mood, how they change the mood time to time, mood disorders. Have you experienced these mood disorders due to some reasons? Sudden mood changes, uh, reasons that, yes, due to some what we call due to some medicines or some drugs, some liquor, having some liquor.
No, madam.
Yeah, yes. Yeah, some disorders can be observed due to some drugs. So
Yes.
experience unusual mood disorders from we call one type of mood is mania, the other type of mood is depression. Two type of mood disorders. Mania is the positive or the very positive side, not the positive, but the one extreme in the down feeling, up feeling called mania, down feeling called depression. So if one moment one person will show some symptoms of the happiness, and the other end you show the feelings of the worry or the depressed, the sad to happy. Very quickly change these moods. That is the experience unusual mood disorders. So at very quickly they change their moods. So very happy mood to very sad and hopeless mood. So very quickly they change their mood, and they have normal moods in between. These between these two ends, you can feel some normal moods also. So this is we call bipolar disorder. This is also come with the some biological reasons, biological malfunctionings, or some uh, severe weaknesses of our brain and the nerve system, as well as the what we call the releasing of some hormones. So severities of these biological malfunctioning may be the reason for this bipolar disorder. So if you have taken some we call the drugs, then it may affect to our nerve system as well as the releasing of the hormones. That is why we can observe severe mood disorders of the drug addictives. Addictives. So those drugs directly affect to our nerve system and the hormones very
Excuse me,
quickly
madam.
change our moods. Yes,
मैडम मैं मैडम के बैठते
tell
हैं
me.
मैं सादे टिका को मत मैडम मैं माइक के साथ देखो
Henna's
अरे इसला मैं
Hari Hari.
the tail liner से प्रोडक्ट में साउंड का डाउन होना मैडम
Hari Hari. Kamu tika sadi mo kata. Okay, thank you. Bipolar disorder or as mood disorders, and we can observe the unusual behavior of our moods and unusual changes of the moods. Mood, we know what the mood is, so changing of a mood very quickly is not good, not very acceptable way. So due to some medical reasons, due to some yeah changes of our hormone and the changes of the nerve system, we can observe these uh, unusual mood disorders. Okay, and upfeel we call upfeeling or the mania, the happy mood. We can observe the happy mood suddenly change to the down feeling or the depressed or the sad mood. These two extremes can be observed, and if the person is suffered with this bipolar disorder, we can observe these extremes very quickly or at the same time. That is what we call bipolar disorder. And here these are the causes or the reasons. This is also very difficult to understand the reasons as the previous disorder or the disease, and these reasons are not clear. Causes or the reasons are not clear, and there may be some genetics. Uh, this is same as with the previous disorder. Genetically, these disorders can occur, comes from family background or the genetic. It can be observed, and genetically we know some not this not with the father and mother, but previous generation, if someone suffered with the similar disorder or the disease in their previous generations, then those genetics can active with after some generation. So this is called genetical issues. කියන්නේ නිලීන වෙලා තිබිලා ආපහු ඥාන සක්‍රිය වෙනවා, ඇක්ටිව් වෙනවා. එතකොටත් වෙන්න පුළුවන්. So this is genetic reasons and abnormal structure of brain and brain chemistry. So structural abnormalities of a brain can be observed. Structural abnormalities of the brain can be observed, and the biochemistry, brain chemistry is also can be changed. Different chemical changes, different chemical reactions also can be a reason for this type of behavior. So this here, the drugs and other medicines may play a major role to change these moods. You know, some because some drugs affect to our nerve system and body chemistry. Okay. Problems with brain circuits that manage mood and thinking. So you know that the brain will manage all the activities of a person. It can be changed due to different reasons, different drugs. So will be the reason for this mood changes. And lower level of dopamine. Here also, dopamine is a hormone increased from our from the organs, from the brain. So then this, if the normal level is not there, then you can observe the changes of a mood or the bipolar disease, and abnormal function of the brain. So here also, if the brain does some abnormal actions, abnormal activities, then you will observe the changes of the mood. And there are some environmental reasons, affections, environmental affections. Environment also may affect with these bipolar changes. Some viral infections, viral infections may affect to the mood changes, and this is very important important situation, highly stressful situations. If the person is suffered with with stress, I told you that stresses are not good, but some stresses are good actually. But if you suffer for long period with the stress, then it is not good. So highly stressful situations make you severe, sick. So you need to think on it. So you need to release your stresses, manage. You need to manage your stresses. So highly stressful situations, stress is very mild disease or the disorder, but if you suffered it with for a longer period, longer time, for years and years, then you may come up with this type of brain malfunctions, or the abnormal functions of the brain due to some minor stress. So this is why we want to manage stress. This is why we call that working with the stress is not good for us. We need to find a solution for those stresses. And finally, the fourth reason is drugs. If you take different type of drugs, it directly change your dopamine level and the brain functions. That is why we always talk the drugs or the addictions may cause to your normal functions of the brain as well as other cognitive functions. So, sorry, excuse me. Drugs also play a major role when it comes to this type of diseases, psychotic diseases or the pathetic diseases. These are the causes. And one other disease. Now we talk about two psychotic diseases, schizophrenia and the bipolar disease. And here we come to the ADHD. I think I have added this slide to the last lesson also. Attention deficit hyperactivity disorder, ADHD, called attention deficit. So we can observe several or number of students in the classroom. Attention deficit. They cannot keep their attention in one place. So you also may have seen or observed experience type of disorders, attention deficit hyperactivity. So the inability to keep one's attention focused on a task. They cannot focus their attention on a task, on a specific task. If they are in a classroom, they cannot focus to the lecture or discussions going on. They cannot focus their attention. Their attention goes here and there. Inability to keep one's attention focused on a task. So this is what we can observe with this attention deficit hyperactivity. And they have the trouble in organizing tasks. They cannot organize. They cannot organize their thoughts. The thoughts come very rapidly to their mind. That is why they cannot organize their thoughts. Trouble in organizing tasks, and they avoiding things that take efforts. They don't want to pay much attention on one thing. Avoiding things that take efforts. So and they take it leisurely. And problems with hyperactivity. Problems with hyperactivity. Two different type of what we call different type of characteristics. One is they cannot pay attention, and the second one is problem with the hyperactivity, fidgeting, cannot pay their attention on the excessive talking. Excessive talking, they non-stop talking, because they cannot organize thoughts, so they can they speak rapidly, excessive talking, and restlessness. They may feel some restlessness, cannot close their eyes, or they cannot focus their attention. They cannot concentrate on one thing, restlessness, and interrupting others. So if you are a teacher, you may observe these type of students in the classroom. They most of the time they interrupt the others, interrupting others. They cannot work properly, and they do not need others to work properly. So these symptoms can be observed with this attention deficit hyperactivity people. And they do not show the physical signs. Here you cannot observe the physical signs on lab and other tests, but your behavior may change. So here we can use the treatments such as medications and the counseling. Medical treatment do not even, you don't need some medical treatment, but meditations. Meditations work with these hyperactivity people, attention ADHD people. Most of the children are suffered with this disorder. So treatments can be done with the consultation with mental health professionals. You can teach, or you can change the behavior with the consultation of medical health professionals. So this is what I wanted to talk with you today. So we talk about two main psychotic disorders. One is schizophrenia, the other one is bipolar disorder. So, and one other disorder called ADHD, attention deficit hyperactivity. So, if you have any question, you may ask, please. Anything to discuss? Any question?
No, madam. It's okay.
Don't have. So actually, these are the content in your curriculum. I don't see that because you are not going to be a psychologist or a counselor, but these content may be help you to work with your subordinates, with the team members, and in the workplace. So these content have been included into the curriculum. That is why we need to talk about these disorders. I'm not asking these about these disorders in the examination because it will not the what we call reasons and the treatments. No need to talk. No need to ask for the exam, but some you want to know some basic knowledge regarding the disorders. That is why we talk about these disorders one by one. If you have any question, you can ask. If not, I think it's 9:45. I don't want to continue the session because we have enough time. We can stop here for today. And if you have any other question, we can discuss because we have the time. If not, you can put the attendance. You can mark your attendance. If you have any question, we will discuss. Maybe may not be the common matters in privately. Doesn't matter. In some instances, there are some students who are suffered with this type of illnesses, and some students' family members suffered with these illnesses. So they, if you have certain experience, you can talk with us.
Madam, psychology subject එකත් research එකක් එහෙම කරන්න පුළුවන්. එහෙම කරනවා නම් කොහොමද කරන්නේ?
මොකද්ද දරුවෝ මට ඇහුන්නේ හරියටම.
මේ subject එකත් එක්ක research එකක් එහෙම කරනවා නම් කොහොමද madam කරන්නේ? කියන්නේ මේ IT එක්ක
final year project එකද?
ඔව් final project එකකට සම්බන්ධ කරගත්තා ඒක නේද?
ඔව් කරන්න පුළුවන්.
IT
ඒක මේ
psychology වෙනස් වෙන්නේ එහෙම research එකක්.
department එක discuss කර. ඔව්. පුළුවන්. ඒක කරන්න පුළුවන් ඕගොල්ලන්ට. මොකද මේක subject එකක් විදිහට ඔයගොල්ලෝ study කරනවානේ.
එතකොට කොහොමද madam මම පටන් ගන්න ඕනේ?
අපි එහෙමනම් initial discussion දැන් ඔයගොල්ලෝගේ මේ semester 5 6 එකේනේ තියෙන initial discussion එකක් යන්න ඕන. එහෙමනම් මේ department ටිකත් එක්කලා කතා කරලා පර්මිෂන් ගන්න ඕන ප්‍රොපෝසල් එක දී මේ වගේ මොන හරිම මේ ස්ටඩි එකකට යනවා නම් වගේ මේ ඒරියා එකේ අපි ප්‍රොපෝසල් එකක් එක්කලා යන්න ඕන මේ පර්මිෂන් ගන්න ඕන ටොපික් එකට